Hi everyone, Dr. Pannucci here. We've got many questions to our various Instagram pages, phone calls to the front desk, and through other means. And Katie, our social media person, thought it might be fun if I was given the opportunity to not review the questions in advance and answer them in 45-second time blocks. And so these are a random selection of questions to various social media outputs that we have. And it'll be interesting to see what I think about various topics in plastic surgery. Ali off screen will be reading the questions. We will fly them in on your screen as well so that you can see them. And I believe Ali actually has a bell when my time is up. So without further ado, here we go.
How long do breast implants last?
Breast implants, and so there is information on the internet that says your breast implants absolutely have to be exchanged every 10 years. That is definitely not true. A breast implant that is working normally, meaning that it is complete and not leaking, does not need to be exchanged. And certainly examination by your plastic surgeon or any changes in your examination can help to determine if there's a problem. For the newer generation implants, those internally cohesive gummy bear implants, if you cut them in half and open them like a book, nothing happens. So we don't envision those types of implants will need to be exchanged on a frequent basis.
What are the deciding factors between a tissue-based reconstruction versus an implant-based reconstruction?
Definitely will not finish this one up in 45 seconds, but tissue-based and implant-based reconstruction are two entirely different paradigms to allow plastic surgeons to reconstruct the breast mound. In one setting, you use your tummy tissue. In the other setting, you use a prosthetic device like an implant. Certainly patient factors, your size, and your surgical history can help to make that decision. I like to have a very long, an hour or more consultation with new patient breast cancer patients. For patients who are eligible for both, I will give them the option and let them decide. But some patients only have one or the other as an option. In that case, I will steer you toward the option that fits for you.
What's the purpose of drains after a surgery?
Drains after surgery. I did a vlog on this actually on our Instagram about 6 months ago if you want to scroll back. But drains do two things. Number one, when you create a space inside the body, whether it be in a tummy tuck or in a breast lift, you have a large raw surface area on the inside. And just like a skinned knee will leak that clear fluid, your body does the same thing on the inside. One purpose of a drain is to allow that fluid to have a low pressure egress from the body so it doesn't sit and eventually come through the incision line. The other reason is when you're trying to get two surfaces to stick down together, like in a tummy tuck, the drain provides suction and physically collapses those two surfaces to allow them to touch and scar together.
What does the plastic in plastic surgery mean?
The plastic in plastic surgery, so the Greek word plastikos actually means to mold or shape or form. And along the line somewhere, someone incorporated that into plastic surgery. We certainly do use plastic or silicone or other things like that in various avenues, but it's actually a word of Greek origin because we as plastic surgeons mold or shape or form.
Do you still have feeling in your breasts after reconstruction?
It depends on the type of underlying breast cancer surgery that you've had. For women who have had a lumpectomy and a parenchymal rearrangement, an internal rearrangement of the breast tissue, there is absolutely the likelihood that you will retain sensation because the nipple generally will retain sensation by its attachments to normal breast tissue. In the setting of mastectomy, all of the nerves that come through the breast and to the nipple by definition are cut. There are some evolving technologies that use nerve grafting either to a deep inferior epigastric perforator flap or to the nipple itself to try to regain sensation. We are still waiting for excellent data that shows whether that strategy is effective or not.
What's the most common misconception about being a plastic surgeon?
The cocktail party question. What is it that you actually do? Having had this conversation with many people in many bars and restaurants and ski lifts at Schweitzer and everywhere else over the last 2 decades, people inherently jump to, you are a cash pay, sleazy, Lamborghini driving plastic surgeon. And that stereotype is simply not true for us at Plastic Surgery Northwest. We offer the broad spectrum of reconstructive surgery, aesthetic surgery, and we operate head to toe on ages day of life 1 to 99. And I've done both ends of those spectrums. Stereotypes are not a good thing. Come in and meet us and see for yourself.
How do you recreate a nipple during reconstruction?
The nipple, and this is a good one that will actually fly up an image of something called a skate flap. But a nipple is created by raising local pieces of tissue and folding them together. Just like origami will take a two-dimensional piece of paper and fold it to create a three-dimensional structure, we do something similar with nipple reconstruction. We do try to narrow the base and make it so that the nipple will not descend back into the reconstructed breast over time. The longest term issue with nipple reconstruction is that they're expected to lose a vertical height of about 50% by year 1.
What is your favorite type of procedure to perform?
I love everything. My job is awesome and I'm thrilled to go to work every single day. As a fellowship trained microvascular surgeon, I certainly love our microvascular procedures, whether that be abdominal base free tissue transfer for breast reconstruction or limb salvage. The aesthetic side of my practice is wonderful, just absolutely outstanding and grateful patients. I love it all.
Why do some patients have to stay overnight after surgery but others don't?
So the decisions about post-operative admission versus an ambulatory surgery, going home on the day of surgery, are based on a few factors. One of them is the patient. Are you a generally healthy person, or do you have other medical issues that might necessitate you coming to the hospital? One of them is the extent of surgery. Are you having a small procedure under a local anesthetic, or are you having a big 12-hour procedure under a general anesthetic? Sometimes there are also, frankly, insurance reasons as well, but usually it's patient factors and surgery factors.
When you were a kid, what did you want to do when you grew up?
Somewhere there is a handmade paper book from when I was in 6th grade, and I remember that I actually have a picture cut out of Dr. Mario. For those of you that remember Dr. Mario on the original Nintendo, you'll imagine what I'm thinking with that headlight and him prescribing the pills. But there is a book that I made with a captioned Dr. Mario picture that says, with a quote bubble, "Dr. Chris Pannucci cures cancer." And in it I then describe exactly why I wanted to be a doctor. Incidentally, in that same book, I describe how I planned to buy a BMW by age 25, which definitely did not happen.
How does a plastic surgeon become board certified?
The process of board certification involves completing an accredited residency training program, either a 6-year integrated program, which I and all of my partners did, or a 3-year independent program after residency in general surgery. In addition to that, you have to pass the written boards, which is a standardized examination that determines your knowledge base. And in addition to that, there is a 9-month collection period of your own cases, and then usually a face-to-face outside of COVID examination by the American Board of Plastic Surgery, in which you are examined on your own cases and the decisions that you made, and also, similar to this format actually, the ability to create plans based on, here is a picture, here is a brief summary, please describe your plan for this patient. And so when you pass both of those tiers, you can become board certified.
How do you decide if someone is a good candidate for surgery?
This actually comes back to the question before about when do you get admitted and when do you go home. Candidacy for surgery, certainly there are medical considerations, and also there are considerations of urgency. And so if someone comes in to the hospital when I'm on call and they have a severe laceration that requires sutures, we're going to do their operation, because most wounds like that you can't just leave open in perpetuity. But if that same person, if they were very ill at baseline and they came in and wanted something completely elective, we might say it's an elective surgery. You don't have to have that procedure. I don't believe that it's safe for you to do that. So I think the short answer is judgment of your surgeon based on a knowledge obtained from the initial clinic history and physical exam about you, your medical problems, and the surgery that we are thinking about doing.
How many years of school do you have to go through to become a plastic surgeon?
A lot. In no particular order, I spent 4 years in high school, 4 years in college, 4 years in medical school at Washington University in St. Louis, 8 years in residency. 6 of that was plastic surgery training. 2 of those were research, during which I also got a master's degree in clinical research, and then a year in fellowship for me at the University of Pennsylvania in microvascular reconstruction. So that is, hang on, 4 and 4 and 12 and 8 is 20. For me, it was 21 years of school.
How do plastic surgeons learn to do a specific surgery?
So specific surgeries, there are your sort of core-based procedures that everybody does, and those are generally things that you would learn during the residency program. There are also subspecialty type procedures, whether they be craniofacial surgery, microvascular reconstruction, aesthetics, and many people will choose to do either a advanced level of training where they go and work with somebody for a few months, or even a full-on like a 1-year fellowship like I did for microvascular reconstruction. And so there are procedures that all plastic surgeons do, and then there are procedures that require additional training in addition to a plastic surgery residency that only some do.
What's your favorite part about being a plastic surgeon?
There are so many parts of it. There are so many parts of my day that are awesome. And what I'm learning is that I love the act of operating. I love being in the operating room. I love fixing problems in real time and being able to see a problem, conceptualize a solution, and also have plans A, B, C, and sometimes out to E and F that I might need to call upon to fix that problem. But I also love being in clinic because it's really wonderful to work with people and meet with them and talk with them and not only see their great surgical results, but also get to know them personally and see, oh, well, your great surgical result helps you to do whatever it is in your life that you like to do. So I love it all. Thanks very much. This has been super fun. If there are questions you would like to see answered, feel free to send them to Katie through our Instagram page, and either I or one of my partners will do another session like this. Thanks so much.